Mark it.
Okay, here we go. We're rolling.
I'm Sara. I live here in Indianapolis with my husband and dog. And a few years ago, everything in my life and career was going great. I had just turned 30. I had run a marathon. I was eating very healthy. And then one day I saw a lump in the mirror. And so I did a self-breast exam. And at first I thought this could not be anything serious. But I did make an appointment, had all the testing done, and then came to find out at 30 years old that I was diagnosed with breast cancer. It was very shocking and alarming and scary, but in our first meeting at Community Health Network, MD Anderson, my husband and I met Dr. Nate Thepchautry. Dr. Nate went through all the details about the size of it, the severity, and he also told us right out of the gate that I was going to have a survivable cancer, which doesn't make it really any easier knowing what we were about to endure, but it was definitely reassuring. And then after that initial meeting, we were told that I was going to have chemotherapy and radiation. So it was very overwhelming at first, and I spent a lot of time crying in many different offices, but throughout my entire journey, you can name anyone from my team, they would stay, they would listen, they would answer questions. Nobody ever turned away from me or made me wrap it up. That really helped me because, I wanted to understand as much as I could through this. I also received so many words of encouragement from people who were very present in my life to people I haven't heard from maybe since high school. It's something I never asked to be a part of or wanted to, but once you are here, there is just this whole community of people who are understanding. They know what you've went through. It is something that I treasure so much. So looking back, I just feel so lucky. This is the best and worst thing that ever happened to me. And so I have a lot of reflection on how I've changed my priorities, but also a lot of thankfulness and gratefulness for who I am through this and after this.